What are the things that private healthcare defenders can never own up to? What can they never acknowledge? It has to be the amount of suffering that they cause, right? In their pursuit of profit. Since the assassination of United Healthcare CEO Brian Thompson, the US medical system has come under extensive scrutiny for its cruel exploitation of people at the most vulnerable points in their lives. Stories have been pouring out about the horrors that they have faced at the hands of faceless, unaccountable answering machines when they've been denied medical care. BuzzFeed News compiled some of those stories into a collection, and it makes for some dystopian reading for those of us who have healthcare that is entirely covered by our taxes. An $8,600 ambulance charge was denied because the ambulance was out of network. I guess when you're having a life threatening emergency, you should call your insurance company to make sure the ambulance is in network. Another user said, "My husband had to have hernia surgery. He went through the steps and even had pre approval for the insurance company because we had no money to cover this. Then we received a bill for the entire procedure and a notice the claim was denied. He called and was told to resubmit. The person on the phone said that it was a usual practice to deny every third or fourth claim. Isn't that insane? Every third or fourth claim denied for no reason. And the company kept the money. He was able to resubmit and get this done. Imagine being too sick or unable to do this. The second claim was paid in full. They're just interested in big profits." And then, in a heartbreaking case, I think this is heartbreaking, an oncology worker wrote, "When my sister had breast cancer, it eventually metastasized to her brain. Her doctor recommended gamma knife surgery, which at the time was still a little known, but was still a little new, excuse me, but an accepted treatment. The insurance sticked around for months until her doctor was finally successful in getting approved. After the procedure, they did another MRI. All the lesions that were identified in the previous MRI were gone, but in the time it took for the insurance to agree to cover it, new ones had appeared. That's when I knew it was over for her. She died less than 3 months later. It's been 20 years now, and my mum still won't tell me who her insurer was, as I would still rip them a new one. I work in oncology, and I know that brain cancer / Mets are a death sentence among almost all the time. But she still could have had a bit longer if they weren't such fuckers." This bit really broke my heart. Her reaction to learning the news when it was time for hospice still breaks my heart. "I thought I had more time." She was only 43. She should have had more. It's really hard to overemphasize the burning anger that Americans correctly feel towards their healthcare system and like the tragic, heartbreaking stories it creates. The insurance companies, like, more particularly, are responsible for this, and they get a lot of the brunt of the hatred since they're the ones that the Americans are like looking at. They're the point of first contact, or rather the point of no contact, because of course they're met with people who have very little power to actually take action themselves. Decisions are made higher up, and you can never hold those people accountable. These are horrific stories, but what's the logic behind them? Why does this system persist under the weight of its increasingly obvious contradictions? Well, a common assumption is that if they move to an NHS-style system, they would just pay the same amount in taxes anyway. But of course, this isn't correct. For one thing, our healthcare is cheaper because patients with no money are able to seek preventative care early on, and problems don't linger and become more expensive. If you get cancer treatment early, it's cheap to treat. If you have to wait for chemotherapy, if you have to wait for surgery, it's much harder to treat. And for another, we only pay for another reason, excuse me, we only pay for the healthcare and administration, whereas in the US, they're paying for the healthcare, the administration, and the profits of big corporations. They're paying off shareholders, and it'll never be more efficient to be paying off shareholders and paying for the cost of actually delivering the healthcare. According to the King's Fund, the average cost of the NHS of a single ambulance trip is £417, but in the USA, those with insurance can expect to pay anywhere from $250 to $1,000 on top of what their insurance is already paying. Just to emphasize that isn't the total cost. That's just the bit that's not covered by your insurance. So that, you're already paying your insurer to cover you, and then you've got to pay $250 to $1,000 on average, right? That's also an average. There are so many stories, like the first story we looked at, the first example we looked at, where people are paying $6,000 for an ambulance. If you want to see an example of these higher costs without noticeable improvements. You can also like think of the last time in this country that you visited the dentist, right? Dentists in the UK have been privatized by stealth, and everyone hates it. It's expensive, it's hard to get appointments, and people often can't use the closest ones, which like helps to splinter communities. You can't have that relationship with your GP or dentist in a private healthcare system where you have to like travel to go to the cheapest ones or the ones that are in network for your insurance. Samuel, do you think that America will ever catch up on how much better and more efficient public healthcare actually is? Or are they stuck in like a bit of a spiral of decline?
It's a tragic situation, isn't it, in terms of those stories that you've been reading out? And I've been doing a lot of my research in terms of how many people have been denied healthcare and the harrowing stories of people suffering because essentially this for-profit healthcare system has been turned into a money-making system for a few people at the top, which is exactly what you were alluding to. And I think what's striking to me was, as everyone has seen, the reaction online to this assassination of the CEO of this healthcare company, United Healthcare. And I think an interesting point to note is that United Healthcare has the highest rates of denials in terms of approving people's cases, around 32%. So the average in the industry is around 16%. United Healthcare denies around 32% of its claims, which is an absolute disgrace. So from that, you can already tell that people are suffering. They're not getting the healthcare they need. And I think that there is a bit of a realization in a lot of the United States at the moment that this is a system that cannot continue to go on. Bernie Sanders had the right idea. He had a very vibrant movement back in 2016 and in 2020. And what was it based on? It was based on exactly this: providing healthcare for people, not treating every single thing as a money-making venture in the country, you know? And I think that what you're seeing now is people, whether they're Republican, whether they're Democrat, whether they're centrist, they're all coming to that same realization that healthcare is universal. Everyone is going to need care at some point in their lives. And just very quickly, the point that you made earlier about how in the UK we're actually paying less because people seek preventative measures and preventative care. I think that's such a good point. You know, when a lot of the debate bros on in the US have this idea that, oh, you know, in the UK their system is destroyed. Oh, in Canada you're not going to have the healthcare because you're waiting 10 million years for the appointment. Okay, guess what? I'm not also going to experience medical bankruptcy as a result of having my ankle dislocated and having a trip to the hospital. So these are the kind of things. So yeah, I was really glad that you brought up the preventative healthcare as well, because it also makes a system where people are able to actually not have to pay right up front in something that could have been avoided many years ago.
Interestingly, there was a meta study of 38 studies on Canadian and US healthcare outcomes. Basically, they compiled, I think this was in 2021, they compiled a list of all of the studies and compiled this meta study of 38 studies, specifically looking at Canadian and US healthcare outcomes. And it concluded I'll just quote this. It says, not for profit hospital funding results in appreciably lower payments to third party payers in comparison to for profit hospitals while achieving lower mortality rates. Because, again, it's the same thing. I've got other studies saying that they're suggesting that the situation is the same if you compare it to UK healthcare. In UK healthcare, we experience less post-operative complications. So even this kind of myth of the oh well, they have to pay through the nose for it, but those that can pay, they experience a much better quality of service. It's not actually entirely true. You know, they're suffering more with like post-operative complications. And 11% of the UK experienced medical slash treatment errors in 2020, compared with 12% in the USA. Just on every metric, it's
Yeah.
insane how much it fails as a system, right?
And it's just very quickly, just to emphasize, you know, this is the power of corporate lobbying, right? There is a reason why this system has been held in place, and I think that maybe this is another reason why we see such a united reaction online. People realize that the intense lobbying that goes on in Washington in terms of keeping this, you know, immoral and, you know, unethical system in place is why it's still here. It's not like people have not seen what OECD countries around the world, you know, are doing in terms of their healthcare systems. They can see that, but you have the grip of the healthcare insurance industry spending millions, and I think some people in the chat have correctly identified it. It's both parties. when we talk about the Democrats and when we talk about the Republicans, Republicans are openly in their healthcare insurance companies' pockets, but Democrats would like to think, yo, we can make a public option here, or we can tweak this, and we can expand care for elderly people, which is also great things, better than what the Republicans are offering, but it's not reaching that the moment, which is what people want, Medicare for all.
Medicare for all, or just a universal system, because let's not forget, like, we created the NHS when we had no money. Like, we were in masses of debt to the US, debt that we only paid off in the early 2000s. Like, literally, it took us 50 years to pay off. And yeah, and we created the NHS then. The idea that you can't afford to create this kind of healthcare system seems ridiculous. It seems like you can't afford not to. I did want to ask you about what you think the danger is now with creeping privatization here in the
Yeah,
UK,
yeah,
because of course, sort of 10, I think it was about 10 years ago, Nigel Farage was caught on camera saying he would prefer an insurance-based model, and he's never really kind of denied that. He said, "Oh well, we should look at an insurance-based model."
yeah,
Mate, look at what an insurance-based model means. Talk to some of the people who live
yeah,
under an insurance-based model of healthcare.
yeah,
For fuck's sake! But the I think the biggest worry for me, at least, is that Wes Streeting and the Conservatives, the more kind of like the mainstream parties, also have this cross-party consensus that you're talking about here in the UK, right? Where they're like increasingly relying on private provision, even though private provision doesn't provide anything that
yeah.
that the
It
NHS is sort of
extracts.
manpower, right?
Yeah,
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 yeah.
yeah, yeah. Exactly. You're totally right. I mean, I first of all, Wes Streeting cannot be trusted, which I think goes without saying. I think most people understand that he's not an ally of the LGBT community, and he's not an ally of the NHS either. I think there is, yeah, the over reliance and the continuing privatization of a service in the NHS is something that we as leftists, as a country, have to watch out for, because we already see the seeds being planted. I think, no joke. I think there was a tweet the other day where Summer was praising his relationship with BlackRock and inviting these people to the table. This is very dangerous stuff. These are companies, US companies, who have high ambitions to creep into our public health systems, creep into our public systems in general, and get a foothold. And once they get that foothold, it's very hard to get private finance out. As you can see with the PFIs and the initiatives with under Blair, these things, I was even going to say, might seem good on the surface, but I think in 2024, I think a lot of people are actually like, we don't want privatization. We don't want market influence. And I also, just this touches on what you were saying. I read a story the other day about, maybe you heard this, Rachel Reeves inviting bankers into the NHS to see where savings could be made. And I just think to myself, wow, 14 years of austerity, cuts to every single part. They'll claim NHS funding, but we know it's dropped. And you have Keir Starmer inviting bankers. And I watched a video about this, correctly saying, like, what on earth can bankers, what insight could bankers offer into this situation? These are people who usually have, preside over huge inflated budgets, right? In terms of in the banking sector, they're not trying to scrimp and save. So what is the wisdom and logic of bringing bankers into to do this? And it's also it's just also a kind of a bit insulting as well. We have nurses, doctors, healthcare professionals who've been working so hard over these last years to keep the NHS running, and you see that ministers are not responsive to their needs. They're just continuing to push the idea of privatization and push the idea of cuts. It's not working.
I'm also like, I mean, obviously everybody's fed up of austerity. Everybody's fed up of privatization. Like, yeah, but why don't we make everything great? Like, how the water companies and the train companies run everything. Why don't we make everything like that? It's like it doesn't kind of work. But I'm also increasingly skeptical of the idea of running everything at maximum efficiency, right?
Right,
Because
exactly.
I think the example that I heard the other day was like, if you run a post office at maximum efficiency, there's going to be one person who works there. You're not going to have any like staff to either help them or
Yep.
provide cover if they're off ill, right? So you have one member of staff. You're running at maximum efficiency there, and what have you got? You've got a line that's like out the door. Like, you're running at maximum efficiency. You could have like self-service machines, I guess, but like if you've got self-service machines and one of them breaks, you've got your one member of staff who can fix the self-service machines because we're maximizing efficiency. But
Yep.
he's the one like maximizing efficiency in government and in utilities
Yep.
and in things like healthcare services
Mm.
means essentially being understaffed and being underfunded.
Yep.
And I think this is just something we need to start rejecting now. We need to be going, no, actually, I want my healthcare to be a bit bloated. I want there to be enough, like, even if it means
Preach.
somebody's like standing around and hasn't got anything to do most of the day, like, I want that so that when I go to A&E with my child, there is somebody who's like
Yep.
able to see them within like half an hour, you know?
100. I think the idea of rejecting the idea of just profitability, and this is what ties back into like every sector doesn't have to produce money. Every sector doesn't have to be efficiently run in terms of like making it so scrimp and agile. I think especially when, like, again, when we talk about healthcare, people realize this is literally life and death. When you talk about profit in the context of health, what does that mean? These are the questions that I think are good. When you talk about profit in the context of health, it means, for example, in the United States, denying healthcare to people. This is a story, by the way, that I think is absolutely disgusting, and I think about it a lot since I read it last week. A doctor who works in a pediatric hospital, working with kids, and and all that kind of stuff, and he had one child he was looking after who was very sick with cancer, and obviously when you have such a disease, sometimes you have to take a lot of anti-sick medication to stop yourself from throwing up, because obviously a lot of that medication makes you throw up, and it's just a horrible situation. This poor boy was 7 years old. Doctor requested from United Health to get some of this anti-sickness medication. They refused. They rejected it. And I just thought to myself that it's very easy to say this, killings are wrong, and murder is wrong. Yeah, we know that killings are wrong. But what we don't see is the outrage when you have hundreds of thousands of people dying unnecessarily because their healthcare coverage isn't doing what it needs to do for them. It's not providing them the healthcare they need. So I think what you said there is, it really hit the nail on the head. We need to reject the idea that everything must be run for maximizing profitability. Not least because what we can see in terms of the climate can show us reasons why we need to hold off of that idea, and the idea of constant growth that Rachel Reeves and Starmer and his acolytes all preach about.
Yeah, no, I 100% agree. Yeah, I don't want a society that's run for maximum profit,
Yeah.
maximum efficiency. We need to start like challenging these ideas.
What do you mean? I've always
Yeah.
wanted to live in a society where I gave all the maximum profit to BlackRock. What do you mean? I've always, it's been my dream. Absolutely, I'm joking.
Yeah, it's like a great society to live in. Yeah, I think as well. I really think it's an important point you brought up earlier. Like the number one cause of bankruptcy in the US is like medical debt,
That's right.
because it's just like totally inflexible. What's the term? There's no there's a term for it when there's no flexibility to the price. Basically,
In
there's no
inelastic
max
demand, yeah.
inelastic. That was the term. Inelastic demand.
I
That's
can't
the
I
term.
can't claim credit for that. Turn left. Put that in the chat.
Yes, yeah, yeah. That was the term I was looking for.
Yep.
Yeah, inelastic demand.
Yep.
Which of course is how like the theory of a market. Of course, it's more complex than that, but the theory of a market system works. It's supposed to be based around elastic demand and the idea that you can actually choose to go elsewhere. You can choose to reject certain services. You can choose to go where it's cheaper. When of course it never does get cheaper.
Yep.
But you can do that if you're talking about like laptops or something,
Yep.
where you can make do without a laptop. But when you're talking about your healthcare, there's not really a basis for that.
Yep.
You can't
Exactly.
do without it. You just
Exactly.
die.
Yeah, and this again, this is one of the. I'm a bit torn because on one hand, I'm excited about the uniting around this topic with conservatives, liberals, moderates, but I'm also a bit like, I kind of wish that this is like an opportunity for some deeper thinking. If you're, for example, you see like, I'm a conservative and I agree that this, the healthcare companies are doing. I don't feel sympathy for the CEO, and I'm like, well, let's expand on that point a bit. Let's think about other areas where maybe we can trying to
Yes.
drag people left. But yes,
Yes, I agree. It's a great opportunity. Like the opportunity we've been presented with here is a great opportunity as an inroad to win people over and to be like, no, actually, here's why you should be looking at the system more widely. I think the problem is that conservatives, although they agree, that the real crime is the crime committed by the healthcare companies
Yeah.
and health insurance companies. I think they agree on that point. The problem is I don't think they're viewing that as a wider pattern of profiteering within our society and the problems that a system driven by profit can cause.
Mhm.
And I think we're going to need to win them round on that.
Support independent media, support social justice that's there on social media. Thank you. Turn left.